Coronavirus is real. We have lost one relative, and two relatives are right. Our loved ones are fighting coronavirus. And I've spoken to multiple doctors. The curve is increasing in different parts of the world at a different time. And for that reason, people who did not experience this before had not realized, and it was not real for them because they had not seen it. So I'm going to show you John Hopkins University's graph very quickly. And medical system in many of the communities is going to be overloaded and not be able to handle all the cases, new cases that are coming. Doctors themselves are getting infected. So here is the um, John Hopkins data for worldwide. Right now, it's 5.3 million cases confirmed, and not everybody has been tested. Um, of course, the developing countries testing is significantly low. Um, 342,695 people have lost confirmed loss to coronavirus. And if we go country by country, the prevalence is increasing now in certain countries more than the others. Um, so for United States, 1.6 million case confirmed cases, 97,150 deaths, and each death actually it's 97,150 families, their loved ones that have been affected. Brazil has seen increase now, 347,000 and 347,398 confirmed cases with 22,013 deaths. So if you look now, the prevalence in South America and South Asia is increasing now. Very quickly, we'll see um, till 50,000 um, country with the up until then. And if you see the curve for some countries is coming down, but for majority of the countries, the curve is going up. And some countries started seeing cases as late as end of April or beginning of May. So the curve is still going up here for Iran, India. That initially curve was down, and here in April somewhere, it started to peak, and we don't know where exactly it is going. So with Peru, same for China, the curve is flattened. Again, we don't know how much is reported, how much is tested. Um, Mexico is still going up, um, and here's Pakistan's. That curve is going up. Today it's 54,601 cases. Yesterday it was 52,000 cases. Um, and these are confirmed cases. Majority do not get tested. 1,133 confirmed deaths, and it is vastly underreported. Um, and same thing for so many countries. But if you compare here, 54,000 with Qatar's 43,000, the confirmed deaths are only 23. So the medical system, of course, availability of resources, the time when it was checked, all of those things make a huge difference. So um, the conclusion of all of these are real life events and real life cases. So what can we do? So once somebody gets infected, the chances of survival are um dependent on the condition, of course, but Even in developed countries, the resources were saturated. So now, when it is going in more developing countries with more Southeast Asia or South America, the chances are even lower. So think of your loved ones. Think of person you love the most and save their lives by preventing it from happening, because the main intervention is at prevention. And how can you prevent? Just that those social distancing, same techniques that have been repeated on several forums, and many people didn't want to believe them. Coronavirus could survive on surfaces for up till few weeks, and people might not know they have been infected for up till 2 weeks. So you might be spreading it to others without knowing. Now, so many times we use the God's will in a wrong way. So when losses happen, or some of the boldness that we show in not following social distancing is tawakkul, or false meaning or interpretation of that. So if we stand on a road or jump in front of the bus and say, if it's God's will, I will die, of course, that is going to happen. If we were going to just leave it on God's will, then why ever go to the hospital? Why ever seek help? Why follow safe driving or cross the road carefully? So it is same way. Just because we cannot see the virus, um, it is infecting, actually killing more people than other causes of death, and is spreading like a wildfire. So save your loved ones by following social distancing. Wear masks. So even my own loved ones, many of them are still not following these guidelines and not wearing masks, and they're all getting exposed, and it causes a huge panic on our part when we are seeing, on one hand, hospitals getting filled, on the other hand, people are still, on Eid occasion, people are still giving hugs, people are still shaking hands, and are still meeting, doing Eid get-togethers. And on other times, yes, we value these things highly, and we would have done it. We encourage to socialize, but this is not the time. Save your loved ones. Once somebody is sick, then um, the situation is far more painful and scary. And um, we'll invite some. I was talking to one of my pulmonologist friend in Nishtar today, and we'll see if he could join us at some point soon to share what he's seeing. Also, that this is not a usual death. Um, the usual closure or being with your loved one in their last times, um, it is not safe because of the spread. So same thing for funeral, that um, it's going to be by a social service agency, and that is very different model. So all of that could be prevented. All these numbers, again, for these are real life, regular people who were just like me and you, and all of them got affected so suddenly that um, one day, one week they were fine and healthy, and then all of these pandemic um, caused them to lose their lives. So save your loved ones, save your life. Look at your loved ones and follow these guidelines. Yes, a happy Eid Mubarak, and it would be fine if you do phone call or yes, reach out through video call, FaceTime. All those other methods are good to reach out, but not in person at this point. It's okay to apologize. I myself have apologized to few requests, and it's painful, yes. But once we cover this part, then we'll have many more Eids and get-togethers in the future. So thank you so much. Take care of yourself and your loved ones. And this was my first time doing the live version, and let me know how this goes, for any feedback into how we can make it better, and of course share with other people. All right, thank you so much. Take care. Bye.